I'm going to demonstrate palpation of the occipital fibers on my patient. I find the groove between the mastoid and the occiput, and I come to the top of the groove, and I find a bump, which is the lateral part of the superior nuchal line. And I'm going to follow that line all the way medial to his EOP. I'm going to get back in that groove between mastoid and occiput with my index finger right below that bump, that nuchal line. My middle finger will be just below my index finger. And I'm going to palpate by plucking occipital fiber 1, marking my spot, 2, marking my spot, 3, marking my spot with my middle finger. And I'm going to do it on both sides. I get my elbows out laterally so that I can pluck across as if the occipital fibers were vertical strings on a guitar, and I was plucking each string. They're a little less than a 1/4 inch apart, and they're about a 1/16 of an inch thick. And it looks like this. 1, mark, 2, mark, 3, mark, 4, mark, 5, mark, 6, mark, and 7, mark. And whichever one I find, I would explore about a 1/4 inch inferior to see if it's also swollen down there. If it is, we have a visceral issue. Our original palpation was on the underside of the nuchal line, on the underside. So my line of drive when I'm palpating is actually lateral to medial to lateral to medial, and also I to S. So I'm actually pointing my fingers slightly towards the head of the table. And when I find one of those fibers, I go to my occipital fiber trap fiber chart. I determine what level it's at, do something at that level. This helps us tune into possible visceral dysfunction.